What's the best treatment for under eye bags? I'm 29 and a mother of two. My under eye bags after my second child have become more pronounced. What are my treatment options? I'm looking for longer-term solutions and not completely opposed to injectables, although I worry about their safety in the long term.
Thank you for your question. You're 29 years old, and you state that after your second child, the under eye bags became more pronounced, and you want to know what's the best solution, and that you also are willing to entertain the option of fillers, although you are concerned about the long-term uh, impact of these fillers. Well, certainly, I think anyone who's been a parent will nod their heads as they listen to how much their under eye bags became more pronounced as they had more children. I could say that with the photos you submitted, there are certain observations that I've made that I'd like to share with you. To give you a little bit about my background, I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. Oculofacial plastic surgery is a specialty where the doctors are first trained in eye surgery before doing super specialized training in cosmetic reconstructive surgery of the eyelids, the orbit or the bones around the eyes, and lacrimal system, the tear gland, tear duct system. In addition, I'm also board certified in general cosmetic surgery, facial cosmetic surgery, breast, body, etc. So I've been treating under eye bags for over 20 years, and certainly there's been an evolution in the many options that we have to optimize the appearance of the under eye area. Now, when I look at your photos, I notice clearly the puffy under eye bag. So let's define what that is. That puffy area is called lower eyelid fat prolapse. It means the fat that's normally around your eye has pushed forward and created this bulge or hernia. And that is the dominant feature. Although I don't have a picture of your whole face, I'm sure that when you're looking in the mirror, that's what you're seeing first. When I look at patients, and particularly because I also do a lot of facelifts and a lot of facial rejuvenation, cheek implants and volume correction and other things to rejuvenate the face, I always look at the eyes also in the context of the whole face. And what I would suggest you observe by taking a step back is look at the eyelid to cheek area or the volume in the cheek. What we've observed over anecdotally is that women after having children tend to lose a lot of fat in their face. Not everybody, but a significant number of women report that they lose volume in their face. So how does this impact the treatment plan for the under eye bags? Well, for one thing is to be aware that there may be an option to consider after the lower eyelid is addressed, which involves adding volume to the cheek area. So what I try to do with my patients is to demonstrate for them the volume, the paradox of too much puffiness under the eye, meanwhile volume loss in the eyelid to cheek area. So understanding that for the under eye bag, I think that most likely you'd be more of a surgical candidate rather than a filler candidate, because one of the limitations of fillers is simply that the more the eyelid puffy bag bulges relative to the bone, the less you can really camouflage it without making it look more puffy. And we deal with that situation when patients come to us from having had this done elsewhere, and we have to use an enzyme called hyaluronidase to dissolve the material. So in your situation, I would recommend a lower eyelid transconjunctival blepharoplasty. This means addressing the fat pockets from the inside of the eyelids. This procedure we perform in our practice under local anesthesia with light intravenous sedation. That means you don't have to go under general anesthesia. And as additional support procedures to help skin quality, we do fractional CO2 laser, which is a laser to help improve skin texture and quality. And we also use something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and we've used it to help with the under-eye dark circles. So in a combination approach, we are able to really rejuvenate the under eye area. Just to go finish the thought on platelet-rich plasma, we derive it from your own blood and we spin it and we use the growth factors responsible for wound healing that are very effective in improving the color, quality, and just the healthiness of the lower eyelid skin. When it comes to the cheek volume, we use fillers of different types, such as Restylane, Juvederm, and we also combine that with platelet-rich plasma so that there is harmony, so there is a balance, and you certainly can look a lot more refreshed. So I would say that you have a pretty solid outlook in terms of being optimistic, because the thing that I love about, particularly about lower eyelid surgery, is how impactful it is on the person's facial expression. You know, nothing says that you're tired and older and lacking energy more than under eye bags. And our patients have said for years that they're tired of looking tired. So I think that finding a qualified, experienced cosmetic surgeon specializes in this area will help you make this decision and accomplish what you want to accomplish, so that you can at least enjoy your appearance as time goes on. Certainly, you won't be able to address it any other way effectively. Certainly, you could try fillers, but I don't think that that would be advisable. So I hope that was helpful. I wish you the best of luck, and thank you for your question.